Hey, happy Monday afternoon. Dr. Alan Christensen here with you for Office Hours Live. So good to connect today. Here we are mid-September and moving into the fall. Had a couple updates to share with you, one of which was about povidone-iodine as a possible preventive for COVID. I've had a lot of questions come in about that. And the other was about fatty liver disease. How would someone know if they had early fatty liver disease? I'm seeing some friends jump on already. I'm with you guys right now on Instagram and on Facebook and on YouTube Live. So any of those platforms, I'm happy to be with you. And I'll talk about these couple of updates. I'll keep an eye out for your top questions, and I'll be happy to get some conversations going. Cheryl's with us. I'm seeing some other friends. Hey, Kelly just jumped on. I had a really fun interview with Kelly here recently. Really enjoyed that. So yeah, good to see people here with me. Someone from Iceland. A few questions popping in already. Bryn is here with us. Yeah, love to have you here. And Office Hours Live, the questions I like the best are the detailed ones. I think you can Google pretty much anything and get like top level information, right? But how do you get things that are more specific and more detailed? That's what I want to see if I can't provide for you here. So ask a good question, hang out. I'll probably have follow-up questions. My rule is that we answer questions for our friends, but we question questions for our best friends, meaning that we ask more detail and get a conversation going. So that's what we'll do. So yeah. Marcella's here with us. Sylvain is here. Several others. Yeah, and again, thanks again, Kelly. Really fun interview. Enjoyed speaking with you. So a few topics to mention. Let me just pull up an image that I got. I've gotten a ton of questions about the use of iodine as a nasal rinse, as a throat gargle for fighting infections. And, it certainly makes sense. Iodine is a very effective antiseptic, as is bleach. There was a joke some time back about the idea of using some kind of an antiseptic like throughout the body to eradicate the virus. And of course, antiseptics could, but they're not safe things to put on our bodies or inside of our bodies. That's the problem. So we know that iodine is a powerful antiseptic. And it is because it generates massive amounts of free radicals, and that kills microorganisms. But, well, that kills our microorganisms too, it can. And of course, it can get to be too much. The use of iodine as an antiseptic goes way, way, way back. And that's been one of its earliest uses in medicine. There's been various compounds that you paint on the skin, and they can, sanitize, and they can kill certain infections. We now know, this is kind of funny, because of that, it was thought that the color of iodine reflected the need for iodine, and that when the color went away, that meant your body absorbed it, and you must have needed it. This is funny, but we now know that the color change is not from absorption; it's from oxidization. So iodine is invisible. Iodide is dark amber colored. So when you put it on your skin, it reacts with oxygen, and the iodide becomes quite readily iodine, and that's why it goes clear. But in going clear, it's also generating free radicals that can kill a lot of chronic infections, and so it's been useful that way. But the drawback is that it does absorb across the skin into the bloodstream, and that's a concern for those with or prone to thyroid disease. But maybe there's some trade-off. I've had some say, okay, but what if my thyroid's stable? What if this is helpful? And there actually was a study done on this. I want to share this with you guys here. So this was done in the Journal of the American Medical Association, and this was earlier in the year. They gave people nasal rinses and gargles with povidone-iodine to those who had COVID-19. And they randomized them. Some groups got it, some did not, and a clinical trial was done out of this. Now, the thought is that the virus is active in the sinuses and in the throat at early stages of infection. That's not so much where it's creating the whole body symptoms, that's just where part of it is harbored. And that's part of how we are contagious. So if we've got some iodine floating around in our sinuses and our throat, that's why we can infect others, because we can cough, we can sneeze, and we can shoot viral particles out. So this study, it wasn't so much to see if this would cure people of being ill, it was more so if it could make them less apt to infect others when they were already infected. That was more so the question that they asked. And what they saw was that the data was not consistent. They couldn't see a clear benefit for reducing spread. They did see some reduction in the viral count, so there was a lower amount of viral particles. But it didn't clearly translate into reduced spread, which really was the goal. And now I highlighted a section, so thyroid dysfunction showed up in 42% of those given the iodine. A larger percent of people had negative changes to thyroid function that weren't severe enough to categorize as overt dysfunction. But 42% of them had full-on hypothyroidism. They had blatantly abnormal thyroid levels. Now, in this study, it was just done for 3 days, so there wasn't lasting harm that was done. And these were younger men that were free of thyroid disease. So two sides to look at that. One side is, oh, there was no lasting harm, so maybe it's not a big deal. But the other way to look at that is, these are people that aren't apt to get thyroid disease, and 42% of them had it for a while. So if you are prone to thyroid problems, that would probably only be worse. And I've seen a lot of protocols encouraging people to do this like 3 times a day long term. Ooh, no, the risks towards thyroid disease would be much, much higher. Again, these are people who just don't get thyroid problems. 42% of them did in just a few days. So yeah, there may be some small benefit of it in terms of reducing your risk of exposing others. So it wouldn't make you not get sick yourself. It wouldn't necessarily make you recover more quickly if you were sick. It possibly could slightly lower your risk of spreading it to others. That wasn't clear. But you got a darn good chance of it screwing up your thyroid. So that's my response to the popularity now of povidone-iodine as another COVID solution. The data we have on it does not suggest that it would be very helpful in the ways people would think. And if it was used the way recommended, the odds of it disrupting thyroid function would be quite high. I'm seeing more questions coming in. Lizzie, Joanne, Cheryl, Lizzie, are you answering questions about everything or just COVID? Lizzie, great question. The best thing to talk about is thyroid disease, hormone issues, hormone symptoms. I'm really not focusing deep on COVID. I just threw that one out there today because it's come up a lot. Many have made me aware about this as being a popular discussion point. So yeah, Lizzie, COVID is not really my daily jam, but thyroid disease is. And that's why this one made the cut, because this does now become relevant to thyroid disease. If everyone's like painting their throat with iodine, we're going to see a whole lot more thyroid problems. And I'm trying to prevent that. So yeah, that's how that one made it in. Okay, another one that I was hearing a lot about was fatty liver. You know, what's up with this? How do I know if I have this? How is this relevant? So I wanted to quickly just talk about some concepts relevant to fatty liver. And I'm seeing more good questions coming in. Good to see you guys here with me. I will grab a couple of those. Yeah, welcome, welcome. And again, with you all on YouTube Live, on Facebook, on Instagram, all platforms. I'm seeing questions from all platforms as well. So wherever you are, say hi, give me a detailed question. I will see that and I will give a good response. So here's the thing on fatty liver disease. It's common. It's crazy common. It's something that now I think many have heard of. If you're not too weird, because it is still rather obscure, but it's common. This is actually the 4th leading cause of death amongst younger adults. 45 to 54. I'd like to call those younger adults because I'm in that category. Is that fair to call them younger adults? Well, this is the 4th leading cause of death in this age group. This is a big deal. And the rates of it are rapidly increasing. How common is this? Well, amongst those who are obese, 95% of them do have it. However, there have been studies saying that among those who are not obese, those who don't have diabetes, those that have no obvious signs of liver abnormalities, in groups that look fine, when they're checked much more closely for fatty liver disease, 42% of them have it. So it's endemic. It's very common. The first ways to suspect that are really just when your waist, the circumference around your belly button, becomes more than half of your height. Half of your height or more than that. Easy math, if a woman's 5 feet tall, 5 times 12, 60 inches, so half of that, so 30 inches. If the distance around her belly button was approaching or exceeding 30 inches, she should think about that as a concern. We also suspect this when someone's ALT, that's alanine aminotransferase. It's one of the really common liver enzymes on blood test. When that number exceeds 18, 19, either of those, 20 definitely a concern for women. When it's above 19 in women, we think fatty liver can be an issue. So that's a concern. That's where it may be prevalent. What to do about it? Take a peek at the Metabolism Reset Diet. That was really a primer about how to go about reversing fatty liver and getting those triglycerides out and regaining good metabolic health. Okay, so I'm seeing a lot of good questions in here. So awesome. Let's start diving into those. I'm going to do a quick adjustment on my Instagram camera. Boom. Okay, and now we're going. Let's see. So browsing the questions. Feel like you need to be on today's show, etc., letting people know about this. F. Mamvik. Thank you for that. Done the Today Show. It's been a while. I'm curious which topic you're referring to, though, on Instagram, FMVic. Which topic do you feel was so important? You may motivate me to reach out and just write more about it or make sure that I am getting the word out about it. I'm guessing you're talking about the iodine one. I'm not sure, though, but I'd love to hear your feedback on which one you thought was that central. So please let me know, and I'll watch out for that. Another one from the same viewer on Instagram: can adding a quarter green banana flour to your reset shakes for MRD slow my results? So here's a funny thing. I was going to use green banana flour in making a blend of resistant starch. Let me back up a step. So with Metabolism Reset Diet, I encourage the use of resistant starch. It's a category of fiber that dials in blood sugar for like 9-12 hours. It's pretty cool stuff. It's been shown to help break down belly fat, lower insulin, improve the gut flora, do lots of really good things that are useful. Now, I wanted to make a concentrate of that so it would be easy for people to get high amounts that were used in studies. But in doing so, I found that most of the green banana flours that I sampled had inconsistent amounts. And by inconsistent, sometimes they had no measurable resistant starch. Other times they had very good amounts, like 60 or 80%, but it varied tremendously. This is also true of the potato starch products you can find in the market. So I quit advocating those. In that sort of a case, you certainly can use unripe banana or the aquafaba or the white beans that are talked about, or banana peel. They're actually pretty cool too for that as well. We do make a product called RS Complete, and ours uses potato starch and other ingredients that you can find elsewhere. However, ours is the only one I found that's standardized. So we take the trouble to buy these raw materials and then measure the actual RS content in them. And what I've learned is that a lot of things that you would think would have RS may not, or may not consistently have it, or may not have a stable amount. So if you do wish to fortify products with a flour, I would use the RS Complete product. If you're in the United States, you can purchase that on drchristiansen.com. Otherwise, I would focus on some of those food sources. But yeah, I wouldn't expect that to, the green banana flour, though, it could possibly slow the results just because you may not be getting what you expect. And that's why I just quit talking about that. So yeah, but good question. Very logical question. Okay. Let's grab a few more questions here on other platforms. I've seen some really good ones. Let's cruise up a little bit. Here's one that's very relevant. Let's see. Oh, I'm picking and choosing. So here's one from Cheryl. Cheryl, thanks for being a good, loyal viewer. I've seen you here lots of times. Glycogen stores are depleted, and do I need to do a liver detox? I read with hypoglycemia can be confused for thyroid issues. When I had a hypoglycemia episode, they put me on Armour. Armour doses are still increasing. I feel like maybe I don't have thyroid issues. How would I know? And I think you had more to your question, Cheryl. Okay, there was that question in 2 parts. I have hypoglycemia. How do I know if my glycogen stores are depleted? Okay. So Cheryl, yeah, we know that glycogen stores get low when there are signs of fatty liver disease, and that's the ALT elevating, also the waist circumference starting to elevate. And it's not so much the body is lacking in glucose, it's more accurate to say that it's glycogen relative to triglyceride. It's more so the ratio between the two of those. There's too much triglyceride, not enough glycogen. And short answer for good solution is really just metabolism reset, diving into that and following that protocol. In terms of how would you differentiate that from thyroid issues, just screening thyroid function. If we do see that thyroid labs show that your thyroid function is not ideal, we know that would be present. And those two things can overlap. If they do both warrant treatment. By and large, treating thyroid disease, I've really moved away from starting people on thyroid medication and focusing more on the thyroid reset diet. What we see is that 97% of people who are not yet on treatment can see improved thyroid function with the thyroid reset diet based upon multiple clinical trials. Of those on medication, 84% can see improved thyroid function, and half of them can see no longer a need for medication. So those are big claims, and I don't make them lightly. Those are based on multiple human clinical trials. So yeah, that's how I really lead treatment for thyroid disease nowadays. But Cheryl, please give me more detail if I didn't cover that right in some way. I'm happy to make better sense out of that. Danita, just a quick one I can cover. And another theme about Office Hours Live, you guys, I love to go deeper in these topics with you all. So I like to get questions that relate to things we've already discussed, and we can take another stab at that and go further into it and talk about things at a level you may not have before. So with that setup, Danita's asking, did you just review ALT and AST levels? So I briefly did mention ALT levels. So AST is another enzyme. So these enzymes are things that are kept within certain cells, and they're transaminase. They convert some amino acids to other amino acids. So ALT is the most liver-specific of the transaminases that we measure. AST can also show up from skeletal muscle and other parts of the body. And the relevance, Danita, of me bringing up ALT was that it can be an indicator of fatty liver disease. I can actually pull this image down now. Let me go back over here. Yeah, it can be an indicator of fatty liver disease for people. And most interesting, it can be an indicator even within the normal range. When I started practicing, and over a lot of the years, most labs would call liver enzymes normal up to the mid-60s perhaps. Now I think most I see normal ranges ending in the mid-30s, low 40s. But if you're a woman and your ALT is above, I've seen 2 different sources on this. Some have suggested 18, some have suggested 19. But if you're above there, something's not right. And it may not be fatty liver, but barring other more serious issues, that's the most common thing that can do that. So that was why I mentioned ALT and AST. Good one here from Joanne. Are WP thyroid and nature thyroid basically no longer available? Now it's compounding at the Foothills Pharmacy. Yeah, good question. So what is the name of that company again? SPL. Yep, SPL. So the company that was making WP thyroid and nature thyroid, they have their own subsidiary which manufactured their powder that they then tableted. That subsidiary is called SPL. SPL is now selling that powder to compounding pharmacies. So even though they're not actively tableting nature thyroid and WP thyroid, you can get that exact same active ingredient, that same raw material, via compounding pharmacies. Someone mentioned, yes, Foothills Pharmacy. That's one that has been working with them. Any other compounding pharmacy can, if they're not, they can purchase powder from SPL and they can compound that. Foothills, they've impressed me because they are doing pre and post-production analysis of the active hormone content. I also like them because the only inactive ingredient they're using is baking soda, sodium bicarbonate. If you don't like baking soda, well, you're out of luck because your pancreas makes it. You can't get away from it. It's pretty harmless stuff. It's just a neutral buffering compound. So yeah, there's baking soda and then the pure SPL powder. That's the best way to go. Joanne, I have spoken with the manufacturer within the last couple of weeks of of WP and Nature-Throid, and I would focus on the compound. I don't see them having a stable product that stays on the market long term in the near future. Yeah, so I would really focus on the compounded form for that purpose. Another related one, do you know when the antibody support supplement will be back in stock? Yes, thank you for that, Lori. We're looking at probably a few more weeks on that. It went so quickly, and we're actually making a larger batch of it. Lori, stay tuned. So there's a couple more cool things kind of like that are coming out soon. A few more custom things that I made. And I'll get scolded if I say too much more just yet. But stay tuned. In a couple of weeks, I'm going to do an event and just share some more ways to help manage big thyroid issues using safe supplements. And that'll be one that I'll talk about. So yeah. Hey, Rhonda, good to have you here. I see a hi there. Okay. Wow. So Jean, I want to clarify a little bit more. Is ALT higher than 19 diagnostic for fatty liver? Thank you for asking it that way, Jean. That's a really intelligent way to ask it. No, it's not diagnostic. It's suspicious. Really, if it is above 19, it's smart to rule out other causes as well. They can include hepatitis. They can include medication reactions. They can include autoimmune diseases of the liver. But barring other conditions, we really think about fatty liver as default. And ultrasounds are a good idea. They don't confirm fatty liver, but they rule out fatty liver that's more progressed than one would expect. So hopefully that makes sense. And by and large, Gene, in most cases, if there's not another obvious cause for the liver enzymes being high normal, the metabolism reset is the best course of action to help bring them back down again. Good questions here from Tam. This is about some of the foods in the thyroid reset diet. Most plant-based milks have sea salt in them. Are they still green light? Yeah, I'm glad you asked that, Tam. I've put a lot of work into trying to clarify that one. I don't think I had that in the book. I wish I did. So sea salt itself can have a lot of iodine. However, when sea salt is an ingredient in other foods, the amounts are so small, it's really not relevant. The cutoff there is 500 milligrams. So if something you're consuming, like one of those milks, if the sodium content is below 500 milligrams, even if it does list sea salt, you can consider that a green light food. So that's a cool way to just open up a lot more options. So yes, if sea salt is an ingredient and the food provides fewer than 500 milligrams of sodium per serving, it's okay. It's still green light. So very good question. Okay, so I've got a ton of really good questions. I want to try to find some that are related. German Shepherd Mom, are sleeping pills really bad for the liver? German Shepherd Mom, yeah. One of my closest friends my whole life was a German Shepherd dog. She passed away many, many years ago, and I've never bonded like that with few other dogs or perhaps even people. I don't know, but I still see German Shepherds and just, yeah, such a good dog. So sleeping pills. Well, they're not so much bad for your liver, but they're horrible for your brain, and they're bad for death risk. I wrote about this a while back, German Shepherd Mom, but there was a paper looking at rates of fatalities secondary to normal Ambien usage. So this is zolpidem, one of the most common sleeping medicines on the market. And they looked at the rate of mortality on people who sporadically used Ambien. And what they saw is that people who sporadically used Ambien and were heavier had a 9-fold increased risk of all-cause mortality than those who did not. Among those who were not heavy, it was a 4.5 times increased risk of death. Now, the freaky part is what they called erratic use was up to 18 doses per year. So like a dose every 3 weeks. I'm sorry, they called that regular use. Yeah. So regular use could be like 1 pill every 3 weeks. That's enough to give you a 9-fold increased risk for death. I won't go onto too much of a tirade, but you don't really get more quality sleep. You get knocked out for a little bit, you get some more shut-eye, but you're not getting more restful, restorative sleep. And there is cumulative brain damage and cognitive decline from that as well. So they're not as bad for your liver, but they sure the heck ain't good for anything else. Yeah. One quick point on that. I've written about the wake protocol and the wake therapy protocol that's in the metabolism reset diet. And it's been studied. Those who've been on sleep meds for years can safely start the protocol and, with their doctor's knowledge and blessing, stop their meds on day one and not need them. So even those that couldn't sleep with meds, they can transition quite easily with that. Again, make your prescriber aware, talk to them what you're doing, but the wake therapy protocol and the metabolism reset diet is incredibly powerful. Sleep meds, A Beautiful Life 96. Yep, that's what I'm ranting about, is sleep meds. The main ones referred to are Ambien/Zolpidem, but this is true for Lunesta, for benzodiazepines like Xanax. It's even true to some extent for those who regularly use Benadryl as a sleep aid. Some of these same issues can show up. So yeah, pretty shocking stuff. Follow-up questions, always looking for those. So Taylor, Foothills Pharmacy, where is this located? They're in Mesa, Arizona. I just want to say they don't pay me. I'm not financially tied to them in any way. I've come to connect with them and respect what they do. They're doing helpful things for people with thyroid disease. They do fill prescriptions in all states except Mississippi and Alabama, unfortunately. But all other 48 states, including Alaska and Hawaii, they can fill prescriptions. So if you are looking for NP thyroid, WP thyroid, your prescriber can write your prescription. You can send that to Foothills Pharmacy. They can ship that and manage that wherever you are. And they would want to prescribe compounded desiccated thyroid, and you would basically get WP thyroid with only bicarbonate of soda, with only baking soda. So easy thing. The other cool thing about that is they can make more potencies. So if you're somewhere to where a 1 grain is too little and a 1.5 grain is too much, they can make any amount that your prescriber and you decide is ideal for you. And they are doing pre and post-production analysis. So I respect them. They're doing a good job, and that's a great option for those, with the exception of those in Alabama and Mississippi. A Beautiful Life is giving some really good advice on safe ways to help sleep. Thank you for that. Yeah, you can check that out over on Instagram. She's got some good things she put up there. And lots of good questions. Let me grab a couple more. So here is one. This is from Kathy Martins. Dr. Isabella Wentz said people with CBS gene mutations may have an issue breaking down selenium. Not sure if it matters, but can selenoxyl maybe work better for us than selenomethionine? So great question, Kathy. Isabella is a dear friend. She gives really good advice. Selenium is not broken down. There's no breakdown process. We don't have to make it into anything. And that's true across the board of chemical elements. Not only do we not need to break them down, we can't break them down. And we can't even chemically break them down unless we have a particle accelerator. So yeah, selenium is selenium. Now, there are different forms of it, and they can be different in some ways from one to the next. The selenoxyl, I do like that. I do also like selenium citrate. Selenomethionine is not a bad option. I like selenocitrate and selenoxyl the most because they're not apt to bioaccumulate. They're not going to build up inside your body. It's not a common problem, but there are times in which people get more than they need. And it can become harmful, and it can actually cause hair loss and some other issues. So there's generally a risk for too little rather than too much, but it's not impossible to get too much. So I love the versions where you won't bioaccumulate it. We know that you won't build it up from some studies that I almost don't think were ethical, but now they were done, we have the data and we know the knowledge from them. They gave preschoolers in Brazil Brazil nuts, and like a lot of them, like a third to a quarter of their diet was just Brazil nuts. So these kids got insane amounts of selenium, and they watched them for their overall health. They measured selenium in lots of ways, and they watched them for selenium toxicity. Now, what happened was the ways you could measure selenium in their blood did elevate but stayed healthy and steady. The ways you could measure selenium in their hair and in their nails got very high. So their bodies were dumping out selenium, but it wasn't building up. And they were compared to some peers, some other kids like them, who were not getting massive amounts of Brazil nuts, and they were healthy. They were really thriving and doing well from that. So what we learned was that the type of selenium in Brazil nuts is primarily selenocysteine, and that's a form that will not bioaccumulate. You can't really get too much of it. Okay, Kathy, that's what I wanted to know. I won't bioaccumulate selenium. Thank you for that. I did apparently figure out what you meant. There's been a couple times in which selenium has been produced in ways in which it had the wrong amounts. And some can bioaccumulate it. They can actually build it up, and it's quite toxic. That's not a common problem, but I just love as much safety margins as possible. So I like things that really aren't apt to build up. Okay, so let me grab a couple more here. Mary Ann, what about melatonin for sleep? Good question. It's something that I'll talk more about in the coming weeks. I'm not a fan of the current products. There's so much research on the efficacy of melatonin, and all the data points to tiny amounts being safe and helpful. But the amounts in products are always 10 or 20-fold above that. So I'll talk more about that, Mary Ann, in a couple weeks, but put a pin on that. I wouldn't do it for now, but there will be some good options in the near term that will change that. Here's from Yvonne with us on YouTube. Good to see you there. Thyroid reset diet helped me get my thyroid number to optimal range. Yay, that's really cool. I was free of hot flashes about a week, then they started back up. Am diabetic managing without meds. So Yvonne, your hot flashes did better. How do I find out where hot flashes are coming from? So Yvonne, yeah, there's different versions of those, and classic hot flashes, we think of them being driven by perimenopause most commonly. What's going on inside the body, it's not a lack of hormone, kind of odd. It's actually a big flux of estradiol. So estradiol going up and down really rapidly. That's what drives them in perimenopause. Very briefly, I'll mention they can occur for just completely other reasons. So chronic illnesses, infections, malignancies, certain medication reactions, other things can cause them that have nothing to do with menopause. I just want to put that out there for everyone. But barring that kind of stuff and occurring in a woman whose menstrual cycles have stopped or have gotten erratic, we think about it being more perimenopause or menopause being driven. So in those cases, the things that lower the symptoms are the things that make estrogen not fluctuate, and also things that make the blood vessels not dilate. So hot flashes are a vascular dilation. They're a vasodilation. So the things that worsen them, caffeine, alcohol, and hot spicy things. So a glass of wine at night, some tea or coffee in the morning, and it doesn't take much, and they're not inherently bad things. But if you do those things and you're struggling with hot flashes, try it out. Ditch those habits for a few weeks, see if your hot flashes get radically better. If they do, you can decide if it's worth the hassle or not. Another easy step that helps a lot is the ingestion of ground flaxseed. It takes a couple tablespoons a day, and it takes about 4 to 6 weeks, but it changes your flora in ways that helps your body do a better job making estrogen stay steady and not come back in from your intestinal tract and make those spikes occur. So throwing some flax can help a lot. Soy foods can lower those symptoms for about 80% of women. Some women do not make the genistein in soy into equal. And equal is the thing from soy that makes it work well. So for some it won't work, but for most it can. And that can be edamame, miso, tempeh, any versions of those. And very briefly, no big negatives for soy with thyroid disease. I've talked a bit about that before, so I won't give it a whole lot of time right now. Flaxseed, what about fish eggs? Well, what about fish eggs? So to more detail, it's not really the omega-3. So flax is often talked about as a source of omega-3, and it's a wonderful one, as is fish. But this is a case where there's specific lignans in flax that bind with compounds in the gut and help the process of glucuronidation. So they help to package estradiol so it's excreted and not reabsorbed from the gut back into the bloodstream. So yeah, not really an omega-3 thing. And for that reason, I did say ground flaxseed, not whole flaxseed and not flax oil. But that's why. Wow, a lot of really good questions. Hey, Kimberly's here with us. Hi, Dr. C. I'm halfway through the 28-day MRD. Realize that I really would like more understanding of your symptoms tracker. Are the symptoms you list symptoms you have before or during the reset? Also, I'd like to understand what the symptoms are an indicator of when related to liver cleansing. Thanks so much. Yeah, Kim, good to see you. Nice to see you here again, and good question. Yeah, these are things that often do change and improve during the reset. So good to keep track on. And the nice thing about that is if you're aware of those, that can help clue you into in the future when it might time for a repeat. Most people I advise to do a repeat once per year for general health, but some will more frequently due to weight goals, some will more frequently due to some symptom goals, and that gives you a good sense of which ones might be relevant. So here's a great one from David Potter. Hi, Dr. C. I am reading your book, Thyroid Reset Diet, about iodine being a problem for thyroid health. Does the American Thyroid Association agree with this? Hey, David. Yeah, great question. So I frequently cite the American Thyroid Association. Now, most of their work these days is on thyroid cancer, but they are a good resource. And I have been involved with them in the past at various points. And yeah, many of the studies I cite are from them. So they've not done the work to go through the studies on low iodine diet, but they have made all the observations such as iodine can be a problem for driving thyroid disease above a narrow range for those who are sensitive. They've also shown that low iodine diets can reverse that. They've also shown that iodine slows the thyroid in Graves' disease. So these are all points that are from their work and from many of their studies, but they've not pulled that together into an action plan. So yes, not only are they agreeing with it, but I'm citing them. I consider them a good source and a good reference for these sorts of things. Okay, so follow-up programs. Here's a follow-up questions. Andrea, would you recommend a functional medicine program for physicians? I'm outside the U.S. and I've been learning through books only until now. Thanks so much. Andrea, yes, so in terms of thyroid health, it's my biggest focus. I have created with another doctor the American College of Thyroidology, and we do work with international doctors, and we do train on the integrative approach to thyroid care. So we are at ACT Thyroid, A-C-T Thyroid, .org, and we are a nonprofit. I'll plug that address in over here on the chat if I can do that on Facebook. Yeah, here we go. I will plug this in so you can visit actthyroid.org. ACT, American College of Thyroidology, we act together to bridge the gap in thyroid care. Isn't that cutesy? No, it's a good group. I'm very excited about that. Lori, is it true that you should wait 4 hours after taking thyroid medication before eating soy foods? Well, in terms of timing, so there are some people need if they have a hard time absorbing thyroid medication, and there's what is a good idea just for people across the board. So there are some to where they have a hard time absorbing thyroid medicine, and they do need larger gaps of time. And sometimes that can include soy foods, that can include calcium products and dairy foods, and that can include coffee. There are those that really struggle that need 8 or more hours after taking thyroid before they drink their coffee. Now think about that, 8 hours, that might be putting you into too late in the day to have your coffee, so that can come up. But that's rather unusual. That's quite exceptional. Most people, even if their thyroid levels aren't dialed in, it's usually not malabsorption. It's more common that their tests are done in ways in which they're not timed consistently, or their own output is changing. Those are much more common. The problem of malabsorption is much more rare than people think. So Lori, normally not an issue, and I wouldn't worry about that really. If you want to put more details, Lori, about what was happening, if your levels were changing, happy to go deeper in that for you. But yeah, usually not an issue. Let's see, so many good questions. Let me grab a couple more of these. Okay, so here's a great one. This is from Vivian. Our standard detox protocols, milk thistle, dandelion, NAC, help with it. They help with the fatty liver. Well, Vivian, not a lot of data, and some of them may be contraindicated. Milk thistle, I learned this when I wrote the Metabolism Reset Diet. That's probably a really bad idea if you've got fatty liver. So what it does is it makes liver cells less permeable. And if you were just exposed to carbon tetrachloride or Amanita muscaria alkaloid or some other type of a acute phase toxicant, that may protect your liver because you're just shutting down your liver. You're closing all the points of entry to your liver. But in doing so, you also make your liver unable to get things out. So things that are already inside of it. So no, for fatty liver, I really don't, these can be sometimes useful adjuncts, but really it's a matter of getting the triglyceride, the fat out of the liver. That's what needs to be detoxed, is the fat from the liver. So that's really what the Metabolism Reset Diet does well. And the issue is that there's how much fat is there relative to how much glycogen is there. If your liver has a little fat, a little glycogen, life is good because it can use the glycogen to burn the fat. But in the case of fatty liver, there's too much fat and too little glycogen. So it's kind of like you've got this big log that you can't light with a match. So my son turns 18 in a few more days. He'll be camping with some friends out in the woods for his birthday party, and they'll have a campfire, I'm sure. And I can imagine some of the kids haven't been camping much before. He's very seasoned in the outdoors, so he'll be fine. He'll take care of things for people. But I can imagine some kids like holding a match on a log and being frustrated when nothing happened. You can't light a log with a match. You need kindling, right? So that's what glycogen is to triglyceride. You need glycogen to burn triglyceride through a process called beta oxidation. Fun fact, you guys, you can really wow your friends with this one. So ketosis, that's not what happens when you're burning fat. That's what happens when you cannot burn fat. When your body cannot run fat through beta oxidation, it converts triglycerides into ketones. And ketones are pretty much just like triglycerides in most ways. So yeah, you're not burning fat when you're in ketosis. You're converting fat into something that's a lot like fat. You can only burn fat via a process called beta oxidation. That's often quite surprising to people. But yeah, very, very good question. TAM-T. So here's a very important question. Is sriracha a green light condiment? It was not listed in your book. TAM-T. Well, this is a critical issue, and I think we should resolve this one in the moment. So I'm fairly certain it is, but I'm not totally certain. So let's do this one in real time, you and me, TAM-T. Let's get the ingredients. And I know sriracha is, like there's one common one we see that we think of. And I'm going to pull that one up and see if I can't find the ingredient list. Here we go. So what I'm thinking of is really how much there is for fish extract in it. If there's a lot of fish extract, that would be a concern. So the list that I'm seeing is saying chilies, garlic, sugar, salt, vinegar. Yeah, I'm not seeing ingredients besides those. If you saw a version that had fish extracts or fish sauce high up in the ingredient list, that one might be a concern. But otherwise, that would be green light. And I'm a pretty big fan of sriracha myself. So yeah, happy to share that news. Okay. Other good questions. So here's from Kathy. Let's see. I am just starting the MRD. I need to lose 80 pounds. Even though I will only lose part of that my first round, will my metabolism still be much better? Are we only allowed to do it every 2 months, so it will take me a year to be a metabolic goddess? Just ask it. Kathy, that's a wonderful question, and kudos to you for diving into the Metabolism Reset. I hope, Kathy, that you found our Facebook group, Metabolism Reset Challenge. If you go to that on Facebook, you'll find it. Anyone can join. It's free. And we've had 20-some-odd thousand people come through in that group, and we've got great support and guidance. It's a really wonderful community that I've seen grow from that. So I'd really encourage you to check that out. The short answer is the biggest health changes will happen with your very first reset. So you can be a metabolism goddess much sooner than you would think, because your body, the difference between diabetic and non-diabetic can be 2 grams of fat in your pancreas. 2 grams. So I've got a chapstick here, and here's the cap of it. That's about 2 grams, right? So that much mass of fat out of the pancreas, boom, that's a huge shift in your metabolism. So when you can lose organ fat, the worst stuff there is in the pancreas and the liver, your health just skyrockets. So many things get better. You know, I was just talking to a doctor in South Africa today. She's a great doctor helping people with thyroid disease. I've been really honored to mentor her over the last few months. And I was telling her, she was talking about when she has people with thyroid disease that have unexplained symptoms, what can cause them. And it surprised her, but I've told her that one of the biggest causes for unexplained symptoms is just extra body weight. Chronic pain, poor digestion, headaches, fatigue, brain fog, inflammation in the body, extra fat in the wrong places. It does all that and more. Once someone is, several pounds above their goal weight, that by itself can explain almost any symptom you can imagine. So yeah, it's good to think about any other exotic causes of not feeling well, but that by itself can do it. Depression, tons of data on that. And so the great thing is that when weight loss occurs in a healthy, effective fashion, you can reverse tons of health problems right away because you're getting the toxic fat out first. Now, I want to also honor your goals, Kathy, of coming to a size you would feel better at. And we've had many people in the 100+ pound club who have lost that much weight by doing cycles of the metabolism reset diet. You can totally do that. That might be 3 cycles, 4 cycles, that can happen. But the nice thing about that is I don't want this to be another notch on the diet belt. I don't want this to be dropping and going up. I made this to really be lasting fat loss. You can have the pounds come off and stay off. We've seen extreme diets cause weight loss and then cause 97% of people to gain more than they lost. Metabolism reset doesn't do that, and I don't want that for you. So yes, it'll take you a little while to get there, but it's going to be good and you can stay steady. And I'd love to hear your progress along the way and hear feedback when you get there. So thank you for that question, Kathy. And come on over to that group and keep us appraised of your process. And come on back here on Mondays and check in. I'd love to hear and see how you're doing. Okay. This has been a great connection, you guys. It's been a lot of fun. Let me see if I can try to find one more. Another question, Susie. I don't know if you asked this question before or if someone else asked the same question. Cause of hot flashes subsided, but nights which cause me to wake sometimes during the night. Yes, Susie, please play back the replay of this. I went into those in some depth earlier along and gave some input there. Tam, I like spicy foods just like you do, so I'm with you on that. Kathy, I read in a magazine a great reference that vitamin E helps with fatty liver. True. So I've written about fatty liver and I've talked about various things that have been tested and shown to be useful. Vitamin E is one of those. I don't really think about it though as if you've got fatty liver, take vitamin E. I think about it more so if you have fatty liver, you should include vitamin E. You shouldn't be lacking in it, but it's not going to turn things around by itself. I do include it in the daily reset packs, and I do encourage the daily reset packs for those doing the metabolism reset diet. So you want some there, but it won't do it by itself. Okay, so that's what I got. It's been a good group here tonight. Good to see you guys. It's been a lot of fun. We talked about iodine. If you came in later on, at the very beginning, I talked about iodine as a COVID treatment and why that's a popular thing being talked about, and how it can be a big risk for those with thyroid disease, and why it may not help as much as you might think, the limits of its benefit. We also talked about fatty liver. That kind of went on and off, and we had a lot of great questions. So good to see you guys tonight. I'm going to be back with you all next Monday, barring the apocalypse or things along those lines. And I hope you take great care in the